Hi, good evening. I am Mary Sariliana. I am here today with Dr. Jace Joy and Dr. Sameer Khan. We are here to discuss about the common questions from patients to dental doctors. Okay. First, what are the common problems associated with teeth? Can you explain, Dr. Jace?
Yeah, the most common complaint from the patients associated with the teeth is toothache. The toothache can be due to the cavity in the tooth, the dental caries, or it can be from the gums. So the toothache is one common thing. The second, as I told, from the gums, like gum bleeding or bad breath. The other complaint can be sensitivity from the teeth, discolored teeth.
Okay, and what is the right time to start braces, doctor?
The right time to come for a checkup for braces would be around 7 to 8 years of age, because at a young age we can actually, pick up some jaw problems which are usually neglected until a later duration. So around 7 to 8 years of age for a first checkup is fine. Otherwise, once all your permanent teeth are out, anytime you can start braces.
So, okay. And what are the common case of sensitive tooth, doctor?
The sensitivity it can be due to multiple factors. So I have this model of the normal tooth. As you can see, this is the enamel surrounding the tooth. This is the protective layer, and inside we have the dentin, and after that this is called pulp, where we have the nerves and blood vessels inside. So what happens if you are doing excessive brushing with excessive pressure in the hand? If you are doing over brushing, what happens? We are removing the outer layer of the teeth, the enamel. Okay, so it is coming close to the nerve, so it will make sensitivity. The other factors are like if you are using more acidic food or drinks, again we are damaging the enamel. There is acidic erosion. So otherwise, as I mentioned before, the dental cavity also can make sensitivity.
So this it is not advisable to have the brush, the hard brushes,
No,
for the teeth.
normally the dentist recommend medium,
soft or medium.
not soft, medium bristles, and make sure you change the brush regularly. Like you can check the brush if it is the shape is spoiled.
Oh,
That means this time you change the brush.
okay.
If you are using the same brush for a long time, it will get more hard, and it is more rough, so it will remove more enamels.
Yeah. Okay. And Dr. Sameer, what are the treatments available to correct the wrong habits like thumb sucking?
Usually when a patient comes in with a main complaint of thumb sucking, we usually give an appliance. When the patient wears the appliance, they are not keen on putting their thumb in their mouths. So there are a lot of different habits, not just thumb sucking, but being thumb sucking one of them. We have an appliance which is like a guard which prevents the child from putting the thumb inside, and it's a removable appliance as well. Sometimes you fix it in their mouth, but it's just that you put something in their mouth so that the child takes their mind off of keeping their thumb in their mouths.
Okay. And I heard about the nursing bottle syndrome. What does that mean?
Usually parents, they keep the feeding bottles in their babies' mouths and carry on with their work. So this ends up with a layer of milk forming around the teeth, and because the milk has some sugary substances in it, they encourage the bacteria to grow on their teeth, and the bacteria erodes the tooth, and ultimately you have caries. That's why the term comes up as nursing bottle caries. It's not the nursing bottle itself, it's the milk deposits which causes the decay of the teeth.
Okay. And Dr. Jace, what are the common reasons for teeth discolorations, and what are the treatments for that?
Yeah, everybody wants smart, bright smile. So discoloration can be, all the teeth, the normal teeth are not really white. It is slightly yellowish. It is common. We consider that as a common thing. But if it is severely discolored, we should check what is the reason for that. There can be two types of discoloration: the external discoloration and internal discoloration. The external discoloration can be due to stains from smoking or tea, coffee, something like that. And the treatment for that is simple, the normal cleaning, otherwise polishing, that we can get it done from the dental clinic. But if the stains from inside the tooth, the internal stains, it could be like, some side effects from medicines like tetracycline or some other medicines. Or during pregnancy, if the mother takes some medicine, that also can cause discoloration for the child. And other factor is, fluoride. If there is excessive fluoride, some part of the fluoride is helpful for the teeth to be more strong. But if it is more than the limited amount, then it can make internal stains. In that case, the normal cleaning and polishing will not help to remove that discoloration. Then we have to go for a treatment called bleaching or whitening.
Okay. And Dr. Sameer, is it necessary to remove some teeth for doing braces?
Usually it depends on the amount of space what we have. Some people, they have crowded teeth. That is, it's not in a straight line. And when you need some space to correct it, you end up removing teeth. Some patients, they have more spaces in their mouth between their teeth. So in such situations, you usually don't remove teeth. But so it depends from patient to patient, and depends from one person to another person's condition. So it's just not necessary for them to remove teeth all the time.
Okay, thank you. And if the patient having severe toothache, is it necessary to remove the tooth, doctor?
Not at all. Previously, people, they just want to get rid of the pain and they just go for the extraction. But nowadays, we know the importance of each tooth. So, and we know how important the tooth. So we have to preserve it. And there are treatment options nowadays, like we call that root canal treatment. So if the infected tooth, first we will have an oral examination. Then we will go for an X-ray to make sure how deep is the cavity and all. Then we can treat the infected pulp, the pulp as I told before. This is what happens if there is severe infection or severe pain, the inside structure is infected already. So during root canal treatment, we give the anesthesia to make sure there is no pain at all. It is totally painless treatment. Then we remove the infected area from here, including the nerves and blood vessels. And it can be by multiple visits if there is severe infection. Then we make sure there is no infection and we close the root completely. So the tooth will be saved. But after that we will place a crown to protect that tooth. Otherwise the tooth can break in future. In that case, there is no need to remove the tooth at all.
Okay, that's good. And for doing braces, doctor, do we need to do X-ray?
To do any treatment, first a dentist has to assess how the patient is. So when we take X-rays, we tend to see things which we usually can't see directly. Like for instance, sometimes people have extra teeth. Sometimes the bone structure is not good enough for orthodontic treatment, not supportive of orthodontic treatment. So it's just to analyze if the patient is healthy enough to plan the treatment is when you take X-rays.
So it's better you have to take the X-ray first.
Yeah.
But one commonly asked question is, how safe is the dental X-ray?
Dental X-rays are usually safe, and moreover, when we take X-rays, we are going to use protective gear for the patient themselves.
Exactly.
And as a matter of fact, the regular small dental X-rays what we take, they have much less radiation when you compare it to people traveling on flight. You are exposed to more radiation on flight. So that's one point which no one knows about.
So one more thing, in some conditions we don't recommend X-rays, like pregnancy and all.
Oh yeah.
In
That
that
one
case,
cannot
we
do,
don't
yes.
take X-rays.
Even if it's not that harmful, but still it's not safe for the pregnant
No,
woman.
pregnancy we don't take X-rays. That's what we take the history of the patient during our consultation.
Okay. And Dr. Jace, is it necessary to remove the wisdom tooth?
Wisdom tooth, it's not necessary to remove the wisdom tooth. Sometimes the wisdom tooth will make some issues.
Okay.
But then in that case, the patient goes to the dentist. Then dentist will have the regular checkup, and if it is required, as we told, we will take X-ray. And in some cases, there will not be enough room for that tooth to come out completely. That's called impacted wisdom tooth. In that impacted wisdom tooth also, we don't have to remove that wisdom tooth just like that. We will keep it under observation. Some conditions it will be straight, sometimes it will be impacted horizontally. It can make some issues, like it can make problem for the adjacent tooth, like the food can stuck there and it can make cavity on that one. And otherwise that impacted tooth itself can make an inflammation around the surrounding gums. We call that periconitis. In that case only, but according to the guidelines, we have to wait. And if there is severe complaints of pain and swelling, bleeding, like if there is 2-3 episodes of pain like that, then only we recommend to extract the. If there is issues like that, otherwise we keep that particular tooth under observation. We take X-ray after 6 months to make sure there is no other problems associated with that wisdom tooth.
Okay. And thank you so much for having this discussion with us. I hope it will help our viewers to clear their minds about what dental issues. So I hope they're happy to what we are doing. Thank you so much. Thank you so much, Dr. Jace.
Thank you.
Thank you.
Thank you so much, Dr. Sameer. Thanks.